Welcome back to the EKG Detective for video 14. For this episode, we will be looking at second degree type 1 heart blocks. The EKG Detective is dedicated to helping people make the transition from using inductive logic to deductive logic. And if you'd like to learn a little bit more about the difference between the two, you can go back to video 1, where I spend some time talking about the differences between the two. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using is the EKG Detective phone app. The app, unfortunately, is no longer available for Androids at the Google Play Store due to technical support issues, but it is still available at the Apple Store, and you can just keyword search EKG Detective, and that will take you to the page to be able to download a copy of the app. But you definitely don't need to have the app to be able to work through the process of deduction. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. So with all heart blocks, there's issues with conduction either through the AV junction or conduction at the AV junction gets blocked. And there's basically four types of problems that we're going to be dealing with when we're dealing with AV block. The first one is we may have delayed conduction through the AV junction. The second problem we might have is it will hinder conduction through the AV junction, and then it ultimately gets blocked. The third problem is we might have an intermittent block through the AV junction. And then the last problem that we're going to run into is the AV junction will be completely blocked and won't allow any electrical impulses to come from the atria down into the ventricles. So the first problem with conduction through the AV junction is the impulse is ultimately going to get delayed. In this ECG, here's an example where the impulse is getting delayed through the AV junction, and we just have a prolonged PR interval. The second problem is the impulse will get hindered, and ultimately it's going to end up getting blocked. And this is an illustration of that problem where the electrical conduction gets slowed down, and all of a sudden we have a P wave without a QRS complex. The third problem is when we have an intermittent blockage of impulses through the AV junction. And here's an example where we have some P waves that do get conducted, creating QRS complexes, and then we have some P waves that don't get there and don't create or allow for the ventricles to be depolarized. And then the last problem is when the AV junction is completely blocked and we have two independent rhythms that are occurring. We have the atria that's depolarizing independently from the ventricles that are depolarizing independently. All right, let's go ahead and jump into identifying this rhythm. So as usual, the first question that the app is going to ask us is if the rhythm is regular or irregular. So when we are looking at a second degree type 1, this rhythm is always going to be irregular. And the irregularity is going to be caused by groups of beats or group beating. So if you look at our first example, we're beating in groups of 2. The second example, we're beating in groups of 3. And then the third example is that we're beating in groups of 4. The one thing about a secondary type 1 is if it's beating in groups of 2, it tends to consistently beat in groups of 2. If it's consistently beating in groups of 3, it's going to consistently beat in groups of 3. If it's beating in groups of 4, it's going to consistently beat in groups of 4, and so on. It's very unusual for a secondary type 1 to beat in groups of 3, then 2, then 4. The group beating is always going to be consistent. So since this rhythm is irregular, we will go to the app, we will select irregular, and then we will hit next to go to the next screen. Referring to our checklist, since we know the rhythm is irregular, we can deductively eliminate any of the rhythm options that are regular. And as a side note, anybody who is interested and would like a copy of this checklist, just reach out to me and I will make sure that you get a copy of it so that you can utilize it for future reference in future videos. Question 2 is going to ask us if the irregularity is possibly caused by PACs, PJCs, or PVCs. So let's go ahead and take a look again at the criteria for these fundamental ectopic beats. PAC is going to be a beat that's going to have a different looking P wave from the underlying rhythm, but the PR interval is going to be normal between 0.12 to 0.20 seconds. A PJC is going to be a beat that is either missing P waves, or if there is a P wave in front of the QRS, it is generally going to be inverted in retrograde, and the PR interval is going to be short at less than 0.12 seconds. And then a PVC is going to be a beat that has a totally different looking QRS complex in comparison to the underlying rhythm. So when we apply these criteria to all of these beats within this ECG, it doesn't appear like we have PACs, PJCs, or PVCs. So we will go to the app, we will select no, and then we'll hit next to go to the next screen. Going back to our checklist, since we have no PACs, PJCs, or PVCs, we can deductively eliminate those off of our checklist. The third question is going to ask us if there are identifiable QRS complexes. Looking at this rhythm, we definitely have QRS complexes that are identifiable and distinguishable. So we will go to our app and we will select yes, and then we will hit next to go to the next screen. On our EKG checklist, since we do have identifiable QRS complexes, we can automatically eliminate ventricular fibrillation because that rhythm does not have definable QRS complexes. Question 4 brings us to whether there is irregularity possibly caused by pauses. Now, this can be a pretty confusing area of criteria, so let's go ahead and revisit what constitutes a pause and what does not constitute a pause. Looking at our 3 examples of secondary type 1s, one of our examples does have pauses. The other 2 do not have pauses. And at a glance, if you look at these gaps, they all appear to be pauses. But there's one specific criteria that will be present, or needs to be present, to be able to have a pause. And that is when we look at our measurable R to R intervals, the R to R intervals will always be consistent and constant before and after a pause. So looking at this first example, we have 0.64 seconds between each of our R to R intervals, and then there's a gap. Since we have consistent R to R intervals before and after that gap, that constitutes a pause. Whereas when we're looking at our other 2 examples, even though there does appear to be a gap and a potential pause, when we look at these R to R intervals, they are inconsistent across the board. So for these 2 rhythms to have a gap that's associated with a pause, the R to R intervals before that gap and the R to R intervals after that gap would need to be consistent. And since they aren't consistent, at this point, we have no pauses in these last 2 examples. So the one thing about a secondary type 1 is it can present with pauses or it might not present with pauses. So depending on the type of secondary type 1 that we're looking at, you will either select there are pauses or there are not pauses, and then you will hit next to go to the next screen. So since secondary type 1 could have pauses or not have pauses. We would eliminate any of the rhythms that would be appropriate based on the fact of having a pause or not having a pause. Since a secondary type 1 can have a pause or not have a pause, for the sake of this video, we aren't going to eliminate any of those rhythms just because a secondary type 1 can be either or. And the rhythms that we would normally eliminate based off of this specific criteria will ultimately be eliminated as we move through the other criterias. Question 5 asks, are there P waves that appear to be sawtooth and or flutter waves? So for those of you who aren't aware of identifying flutter waves, last month we talked about the criteria to identify them, so you may want to review that video. But looking at this ECG strip, there does not appear to be any consistent flutter waves. So we will go to the app and we will select no, and then hit next to go to the next screen. So for those of you who are using the checklist, we will go to the checklist, and since we do not have sawtooth or flutter waves, we will eliminate atrial flutter from the list. Question 6 is going to ask us, is there or are there discernible P waves? And when we look at all three of our examples, we definitely have distinct and discernible P waves. So we will go to the app, we will select yes, and then we will hit next to go to the next screen. And since there are discernible P waves, for those of you who are using the checklist, we can eliminate atrial fibrillation from the choices because atrial fibrillation has non-discernible P waves. Question 7 is going to ask, are there 3 or more different shaped P waves? And looking at our examples, the P waves that we can see, they all appear to be similar, so there are not different shaped P waves. So we will go to our app, we will select no, and then we will hit next to go to the next screen. For those of us who are using the EKG Detective checklist, since all the P waves are similar, that means we would be able to eliminate a wandering atrial pacemaker, because wandering atrial pacemaker is going to have 3 or more different looking P waves. So question 8 is going to ask, is there more than one P wave for every Q or S? And when we are looking at a secondary type 1, there will be one extra P wave for every group of beats. Now the way that we can determine this is the SA node in this specific heart block is going to be beating regularly and consistently. So that means that the P to P intervals will always be constant. So when we look at this first strip, we can take our 2 P waves that we can see, measure that interval, carry it across the rhythm, and if you look, there seems to be an anomaly at the end of each of these T waves within the group of the QRSs, and that little anomaly or extra bulge is a P wave. It's a little bit easier to see on the second and third example where we actually have identifiable P waves. But when we measure those P to Ps across the board, the extra P wave at the end of the complex will march out. And that is the cardinal indicator of determining if there's extra P waves, is that the P to P intervals will always be constant and we'll be able to identify them. So looking at these examples, there is an extra P wave for every group of beats. So we will go to our app, we will select yes, and then we will hit next to go to the next screen. And for those of you who are using the checklist, since there are extra P waves, that means we can get rid of all of our sinus rhythms because all of the sinus rhythms only have one P wave for every Q or S. The next question that the app is going to ask us is what the PR intervals are, if they're constant or variable. And when we look at our first example, we have PR intervals that are different from one another. Same thing for our second example as well as our third example. As a side note, the cardinal pattern that we will see with the secondary type 1 is the PR intervals will progressively lengthen until we end up with a P wave at the end of the group without a Q or S complex. But the app doesn't need us to look to that degree. It's just going to ask, are they the same or are they variable? And for these PR intervals, they are variable. So we will go to our app and we will select variable. And then we'll hit next to go to the next screen. For the people who are using the checklist, since the PR intervals are variable, that means that we will eliminate a second degree type 2, and that leaves us with the rhythm that we've been dealing with, which is a second degree type 1. And for those of you who are using the app, when we hit next on the app screen, that will take us to the rhythm that we were dealing with, which is a second degree type 1. All right, that brings us to the end of this episode. I just want to reiterate, if you would like to get a copy of the EKG Detective checklist, just reach out to me and I'll make sure that you get a copy of it. Also, if you have any questions about the EKG Detective phone app, you can reach out to me at. And if anybody has any questions in relation to the content of this video or anything in relation to the EKG Detective, please reach out to me at relevanceineducation.com, and I would be more than happy to either get you the resources you need or to answer any questions that you have. So thanks again for sitting through this video, and remember, it is always better to practice as a clinician rather than a technician, and we'll see you next month. Thanks.